A 22 years old man present with painless penile ulcer and is marked inguinal lymphadenopathy. Some of the exudate from the lesion is sent for microscopy. What organism is most likely to be visualized? That means a 22 years old man, that means relatively young, develop painless penile ulcer, and also there is the inguinal lymphadenopathy, and there is some exudate from the wound sides. So what may be the organism for this condition? Here the options are the Treponema pallidum, Nocardia asteroids, Mycobacterium tuberculosis, Mycobacterium leprae, and Neisseria gonorrhoeae. So what may be the answer? So there is a painless penile ulcer, that means there is a disease which is sexually connected. So first of all, let's see a hard painless ulcer. A hard and painless ulcer affect the genital area in young male to be primary lesion of the syphilis. So it is characteristics of the syphilis, that means a painless ulcer which affects the genital area of young male is likely to be primary lesion of the syphilis, and it is usually caused by Treponema pallidum, which is a bacteria. So Treponema pallidum, which is a bacteria, and it is responsible for painless penile ulcer, and usually exudate present. The unusual for actinomycosis to affect this area. The actinomycosis is another bacteria, but this lesion is relatively different from this type of lesion. Now see details about the syphilis. The syphilis is usually caused by Treponema pallidum bacteria, and it is sexually transmitted. That means it transmitted only by the sexual intercourse. Congenital infection is also recognized, but comparatively rare than that of the gonorrhea and other STDs. The typical lesion of the primary syphilis is the chancre, which appears 10 to 90 days of the infection. An indurated papule that breaks down to form an ulcer, and this ulcer is painless. So painless penile ulcer, which appears 10 to 90 days of the exposure, is the characteristics for this syphilis, and typically it is hard and painless. And what are the appearance of the hard ulcer with enlarged regional lymph node can mimic carcinoma. So as there is a ulcer in the penile region and also there is lymphadenopathy, it may mimic carcinoma, but in case of the infection and inflammation, usually the regional lymph node is enlarged. And what is the histological appearance? The histological appearance, it is the dense inflammatory infiltrate. And the diagnosis can be made demonstrate spirochetes from the chancre by dark ground illumination microscopy. So under microscope there is spirochetes present. So spirochetes present under the microscopy, it is the pathochromic for this syphilis. The serological testing for anti-treponemal antibody are also used sometimes. Secondary syphilis usually develops around 6 weeks following the exposure of the disease. That means when the primary lesion disappears, then secondary syphilis appears, and it often comprises widespread roseolar eruption. And the individual who are not treated can eventually develop tertiary syphilis. So syphilis can be divided into the primary, can be secondary, and can be tertiary. So primary, secondary, or tertiary syphilis, and it is characterized by development of the gamma. So the tertiary syphilis, it is characterized by the gamma, and syphilic lesion characteristically affect the proximal aspect of the aorta and may cause the atypical aneurysm. That means the ascending aortic aneurysm, it is fissure for the syphilis. So which organism may be visualized? It is the Treponema pallidum. Other option here such as the Nocardia asteroids, it is usually not common in this area. Then here we can see the Mycobacterium tuberculosis, the clinical feature of the Mycobacterium tuberculosis. This is totally different, and primarily it is the lung dependent. Then Mycobacterium lepra, also it is very rare. Neisseria gonorrhoeae. In case of the Neisseria gonorrhoeae, there is purulent discharge through the urethra, not ulcer. The purulent discharge usually through the urethra. So it is also not Neisseria gonorrhoeae. So the answer is the Trichonoma pallidum.